Hello and welcome back to my channel. I'm Tanisha Shanae, and in this video we will be discussing the insurance approval process. And this may vary for different offices, but as for the office that I work at, this is pretty much what you go through. And again, it may vary slightly, but the process is pretty much standard. So after you have a consult with a doctor, which is basically a doctor's visit, and you're speaking with the doctor about whether or not she would take you on as a client, whether you are a likely candidate, she takes photos of you. And in the photos, we use those to submit to insurance to give them visual evidence that, breast reduction is needed. So she takes photos for you, and then she tells you basically that depending on what you weigh, because it's not everyone, if you are on the heavier spectrum, she will tell you that you need to lose weight, and it's nothing personal. But when you're submitting this information to the insurance facility, to the insurance company, they're gonna already ask for this. So she kind of like cuts down the middle and gets it over with. She's gonna be like, hey, like say you're at like 250 and you're 5'7". Technically on the BMI chart, you're heavier than you should be. So she will recommend that you try to lose weight. And then also the second thing she will recommend is physical therapy. But for the purpose of this video, I call it PT in office. I mean, everything is shortened. So she'll recommend PT or physical therapy, and she'll recommend that you lose weight. And so you'll see her 3 months from your initial visit. And that's 3 months, so you have time to complete your physical therapy visits or your PT visits. And you have time to see whether or not weight loss is something that will affect the size of your breast. So once you're discharged from physical therapy, meaning you're going to your appointment, however many appointments that she tells me that you need, you go to those appointments and you see the physical therapist, and you do different exercises, stretching exercises, sometimes heat therapy. It's like a little pad that they lay over your shoulders and everything. They try different things to try to alleviate the stress of having large breasts. And at that point, once you're done with your visits, the physical therapist writes up a letter and just says, well, not like a letter, it's more so of a visit note. And the note is just basically saying like, hey, this person cannot be helped doing physical therapy. And so then they're discharged. Or the note may say, we need more physical therapy visits to properly determine whether or not this will be beneficial to the patient. So that's what you could pretty much expect. At that point, they'll send that note off to the doctor's office. The doctor will take a look at it, and then we'll contact you. So if the case is that, say that they're discharging you, meaning they no longer want to see you as a patient because they can't do anything for you. So that's what the discharge means. If physical therapy discharges you, then we check your weight at that time. We bring you back into the office for another visit, kind of like a status update, or you could do like a virtual visit. That's an option that our clinics offer. So you speak with the doctor. We check your weight loss progress if you need to lose weight. If not, then the doctor just pretty much prepares you for the next phase of the plan. So the next phase is I get all of the paperwork together, or whoever is in your office, they compile all the paperwork, the photos, the PT, which is physical therapy notes, and then they send it all off to your insurance department. Okay. So once your insurance department receives the paperwork, then whoever your caseworker is, they're going to go over everything with a fine-tooth comb. And then they determine whether or not a breast reduction is needed. So at that point, they'll give us a yes or no. And just like physical therapy can ask for more visits, insurance can also ask for more visits. So insurance can say like, well, we think this patient can be helped with physical therapy, so she needs to do another 3 to 6 more months of physical therapy. So it's not the best case scenario, of course, and I try to tell all patients when they come into the office to manage their expectations. And I try to tell them to just always be prepared for a fight. Because even though you pay insurance, insurance acts like that's their money. Like, no, that's my money. Okay, and I want to use it for this surgery. But they act like that's their money, and you have to prove that you need them to pay for it. Even though you're paying them. But I'm going to let it go. Because I feel a personal way about insurance. Anyway, so if the insurance comes back and they say that they want you to do additional physical therapy visits, then whoever's in your office staff, will write another order for you to go to physical therapy for whatever specific amount of time. And you keep going to physical therapy, and they'll keep, working you out. They'll keep doing the heat therapy, the stretches, all of these things to see if they can build muscle. Because again, insurance thinks that you're just weak, I guess. That's a better way to put it. They think that you're weak, and if you build muscle, you can support the extra weight of your breast. That is not the case for 99.9% of all people who walk through the office. There's no weakness. There's just an abundance of breast tissue. Sometimes, on rare occasions, insurance is asked if the patient has tried any drug therapies that will help them cope with the pain and discomfort of having larger breasts. In cases like that, it really frustrates me and it upsets me, simply because even though I'm not the patient and I'm advocating on the patient's behalf, no amount of drugs is going to make this pain go away. What's the point of basically putting like a Band-Aid on a bullet wound? If you just take the bullet out and you heal the wound, then you won't have all this extra stuff. But again, I'm not going to get into it because insurance makes me so mad at work. Anyway, so if they ask for alternative therapy, if that was tried, or maybe going to see a chiropractor, within reason, you can go and try those things. And then you come back at the end and we resubmit the paperwork, hoping that you have did everything that they've asked you. You met all the requirements so that you can get approved for the surgery. I have seen patients, insurances like really drag this out for months. Like, it's ridiculous. Nobody's story is the same. I have personally dealt with people who work for the same organization that I work for and they were going for, and some of them go straight through the process without problems. And then others, they just keep asking for stuff and they keep asking for stuff and making the whole process very difficult and just unnecessarily hard to navigate, because insurance does not want to pay for things like this. So it really just depends on that person and who gets your case at that time. It's a crapshoot. But after the point that you've lost any weight that you need to lose, and you have done everything insurance required, then we set a date. Typically in my office, once I send off for that insurance verification, I set what I call a dummy date, because OR rooms are hard to come by. So I want to try to get that room secured and locked down as soon as I can. And I don't tell the patients, so your facility might not tell you the preliminary date that they set, but because everything is not in stone at this point, we're just going back and forth with insurance. And so in a perfect situation, if your insurance has been approved, doing this, this part, and I set your preliminary, your dummy date or whatever, then at that point, once I know that it's approved, I contact the patient and I let them know what labs they need to get done, what scans they need to get done. And they do require, my facility requires all patients to get a mammogram no matter your age, because they kind of want to see what's going on in there. And you want to set it in enough time. First of all, it's very hard to get into doctor's offices now, so you want to set your appointment the minute I call you. Get all of your appointments set up and ready. Closer towards your surgery date, you want to do your labs because you want fresh labs. But as far as your scans, you want to get those done as soon as possible because it's really, really, really hard to get in there to get this stuff done. So you set your mammogram date and everything and you get it done, especially if you're in your 20s or your 30s. Chances are they're probably going to come back and see that like there's some type of artifacts or something. That's because your breast tissue is very dense, and so you can get like really weird readings. So again, you want to do it in enough time, so if you have to be called back to do it again so they can like look in detail, you have more than enough time and you're not like kind of rushing to get everything done and taken care of. So once you've done your scans and everything, like I said, closer to your surgery date, you do your lab so that everything is fresh. Of course, you do your COVID test 3 days prior to your procedure. And again, these are just the standard operating procedures for the facilities that I work for. So you do your COVID test. I don't speak English. You do your COVID test 3 days prior to your actual procedure because they want a fresh COVID swab. And then once you get your results, you find out, via phone. Like, no news is good news. Of course, they will contact you. If you have like MyChart or some type of electronic charting system that alerts the patients to your scans and labs, then you'll get notice that way. So anyway, then you'll go in and you'll have the procedure. Right before you have the procedure, of course, I would probably say the week before the procedure is typically when we do the pre-op appointment, like the standard pre-op appointment. Now, again, this can be done virtually or it can be done in person. And you can ask any last minute questions that you want to, with answers that you want to get, like, how much pain will I be in? What should I wear? What should I bring to the hospital on the day of the procedure? That's the time where you get to talk to the doctor and really ask those questions that you want to know. But that's pretty much the entirety of the insurance approval process. It doesn't seem like it's much. It really seems, when I say it out loud, kind of cut and dry. But, that's just when we're talking. But in reality, it's not as cut and dry. In reality, there's a lot of back and forth between the company and the clinic about whether or not the procedures are absolutely medically necessary. And in the case that they are medically necessary, they are 100% covered by your insurance. And then all you would have to pay as a patient is your deductible. And I hope I didn't get like too far off topic and go around the world too much. I got my notes in front of me. I'm trying to like streamline this whole thing to make it easier for you guys to understand. But yeah, that's the whole process, start to finish. You do your consult, then you do your physical therapy, and your weight loss if weight loss is needed. And then you come back at the end of your physical therapy for kind of like a checkup, and then we see where you are and what the therapist says. If the therapist requests more visits, then you do more visits. But at the end of your visits, if the therapist discharges you, then we submit all of that information from therapy, from the doctor's visit, your photos, all of that goes to the insurance company, and then they look over everything and they decide whether or not they want you to continue some type of therapy or they want to approve the procedure. At the point of them deciding, then your date is set at whichever facility we choose, and then you are alerted so that you can prepare for the procedure. That's it, start to finish. If you guys have any questions, please, hit me in my comment section. This is kind of like a general once over, like I said. Anything more in detail as far as like the insurance approval process or the office process, you have questions about that, you can ask me, I can let you know.